Every decision you make in your life is a portal. Whether it is the college you choose, the branch you choose, or the partner you choose, they will decide how well you will do in your life. So, hey, if you are watching me for the first time, I'm Dr. Sanatan and I passed my FMGE in July 2025 with a score of 230 in my first attempt. Right now, I'm a medical intern in a government medical college of Kalahandi, Odisha. In this video, we will talk about the factors which one should consider before joining a hospital for the internship. And what factors made me choose Kalahandi as my hospital of choice for doing my internship in Odisha. So let's start with the video. Factors to consider. So these are the red flags which you should be knowing. Very low patient load. See, every disease is having a specific prevalence in a geographical area, right? Some diseases are 1 in 100, some diseases are 1 in 1,000, some diseases are 1 in a million. So more is the patient load of a hospital, more is the probability of you getting exposure of that disease. So a place, a hospital where interns are used mainly for clerical work? Nah. Very little or no procedural exposure. आपको फोलीज कैथेटर डालने नहीं दे रहे, आपको ब्लड सैंपल्स ड्रॉ करने नहीं दे रहे, आपको पैथोलॉजिकल इन्वेस्टिगेशंस में पार्टिसिपेट करने नहीं दे रहे. सी वेयर टॉक्सिक वर्क एनवायरनमेंट इज देयर, योर सुपीरियर्स आर नॉट असिस्टिंग यू, they are putting blames on you or dragging you into unnecessary things and situations instead of helping you learn. So that's a very big no. Frequent duty hour violations without learning opportunities, poor supervision by residents and faculty. And regarding these red flags, you will only get to know if you talk to some intern who is already working in that facility. So if you are about to join a hospital, do inquire about all these factors before joining any hospital. So what are the green flags? A green flag in a hospital that you should you would love to work. A hospital with a good amount of patient load, you'll get amazing exposure of all the diseases. A hospital with plenty of hands-on procedure. A hospital where the residents and faculties are really supportive. A reasonable work hours, good academics, जहाँ आपको सेमिनार्स एंड प्रेजेंटेशंस में पार्टिसिपेट करने का मौका मिले. That's a amazing experience you'll have throughout your journey of internship. Good campus accommodation, hostel facilities, food. So it's not just about a day or a couple of weeks, right? You will spend an entire year. Unfortunately, as a foreign medical graduate, some of you may get for 2 or 3 years. And you should get plenty amount of time to prepare for your NEET PG or INI set preparations. So all these factors you will only get to know if you talk to some intern already working in that facility. And the most important factor for which the non-domicile ones choose Odisha is the stipend, obviously, which is pretty much same in all the hospitals throughout the Odisha. So not a context to be added here. So this is a question that I am still getting asked even after 6 months of joining my internship. So why the highest FMGE domicile scorer chose Kalahandi? So I could get any college that I desire. So why I chose Kalahandi? So the reason is a bit geographical, a bit historical, and some of my opinions. And if you draw a straight line bisecting Odisha, there were 8 to 9 colleges in the counseling, and out of them, 8 of the colleges were in the northern and northeastern belt of Odisha in this region. And only Kalahandi was there in the western belt here. To the left of the midline, only Kalahandi was the reasonable option here. I belong to the city of Brahmapur, a very beautiful coastal city. And personally, I have explored the entire northern belt, Cuttack, Bhubaneswar, Puri, and all. But this belt was not explored by me. मुझे देखना था the infamous KBK corridor कैसा है, how the facilities are there. Why do I say infamous KBK corridor? The Koraput, Bolangir and Kalahandi corridor. I'll explain in a minute. So, back in 1999, where there was a disaster in Odisha, a super cyclone, in which almost 10,000 deaths were reported officially. Mark my words, officially. We have no clue about the non-official ones. So during that disaster, there was a survey. And according to that survey, there was a corridor in Odisha, the KBK corridor, Koraput, Bolangir and Kalahandi corridor. This corridor was the most underdeveloped region of Odisha. Not just financially, poverty-ridden, but in all the possible aspects of demography, this was the most underdeveloped region of not only of Odisha, but of India and probably Asia. So, due to these factors, I personally wanted to see how the facilities are operating in this corridor at early ages of my life. The hierarchy of clinical responsibility, as it's a budding medical college. As a medical intern, here you're standing just below the senior residents. So no interns of the hospital that are yet graduated. And you will be having the responsibility just below the senior residents and assistant professors. So, इस वजह से आपको authority wise, decision making wise, hands on exposure wise, काफी experience gain होगा compared to the other colleges in the other medical colleges in the list. So this was a factor that I considered amongst many. So if you are a FMG qualified doctor about to join for your internship, I would like you to consider all these factors before joining any hospital of your choice. Before ending this video, there's a beautiful quote, and this image is of the forest roads of Kalahandi. And the quote says, you got 2 lives, and the second one begins the moment you realize that you've got one. Take care of yourself. Have a lovely day. And do comment about your opinions. If you have any questions out there regarding this, do let me know in the comment sections.